Hello, I'm Dr. Swaminathan Iyer. I'm based in Houston. I'm the president of the Indo-American Cancer Association. So Indo-American Cancer Association is a not-for-profit group formed by Indians who moved from here to study in the United States. Initially, that is the concept of having people who have gone to the United States, doctors who have done their training and want to give something back to India. And a lot of us are so grateful for the education that we received here, have very strong roots here, and the strong sense to give back. And most of our training was nothing. It was all taxpayers' money, and obviously we would want to give something more back. And we have this opportunity through what we're doing. Many of us work in the area of cancer. So since cancer is a big problem in India, we thought we would get together. This was incorporated as a not-for-profit group in 2007, and it has about 500 to 600 life members and many more members who are annual members. And today it does not just include Indians, but it also includes people from Pakistan, from the extended subcontinent, from Nepal, from Sri Lanka. And so the idea is that the problems are same, so we can get together. We have a collective effort and will to hopefully help facilitate changes in our countries. So when we initially started out as a social group and then got incorporated, when we think about what we can do to India, there are many things, and especially even in the field of cancer. The low-hanging fruits that we thought we would work with is education, and education was the big gaps in education and technology, and a lot of the work that is done here is theoretical. So many of us who are there, who have gone through the programs, felt that many Indians who practice here or the young trainees need to come and see things out in the United States, learn the technology, bring it back to India, whether it's the laboratory technology or a particular surgical technique or a radiation technique, and so we started through a traveling fellowship program, and now we have grown to we have supported about 74 fellows, and each fellow gets us $5,000 or $10,000 budget, and we match them to the best institutions in the United States. There is a mentor who takes them through the program for about 6 weeks. And they've all come back, and none of them have returned to the United States, but they all come back to the US, and they're leaders, are emerging leaders in their own fields in this country, so very proud to say that. The other program, the other current activity is palliative care, and we had the fortune of partnering with Dr. Rajgopal, who's the father of palliative care, and as Dr. Suresh Reddy in the United States in Houston, both of them partnered to come up with a trainee program in palliative care. As you know, morphine is one of the most important things for a patient who's dying from cancer. The least bit that we can do was to a large extent not available for patients, and so the large efforts of Dr. Rajgopal, morphine became easier, but we also wanted to get the program extended across the country. Palliative care is not just about morphine, it's about a holistic approach, taking the family through the process, not just the patient. And so several train-the-trainer programs have occurred throughout the country, and Indo-American Cancer Association has been doing that. The other role is to support the kids with cancer. We support Can Kids, which is a large social organization here, and we raise funds for them. And so these are some of the major activities that we've been doing currently. In addition, we have a large support from the pediatric oncology to help us with the Can Kids. So as we think about what we can do to India, now we have been one of the big questions is technology will help India, but what can we do to change the face of the problem? And the face of the problem is cancer. So prevention, an ounce of prevention is worth a gallon of cure, as they say. I think large efforts could go into prevention. If you think about a cancer like cervix, the women's cancer, easily preventable, but India is such a large contributor. A 250,000 women die in the world from cervical cancer. And India contributes 70,000 deaths from that. So it's a huge number. It's not acceptable. So we have thought about it, and we have partnered with the WHO organization, International Agency for Research on Cancer, and we plan to have a pilot program in a village close to Udaipur. It's part of the Women's Health Wellness Program. Does not just include cervical cancer screening, but other health issues like diabetes, hypertension, breast cancer awareness, and just general health awareness. And the goal is that this program will help us understand some of the aspects, and our job is to help facilitate the partners here in the in India. So our job is to raise the funds and sort of facilitate interactions and help the governments and other agencies to take up from there and make this not a problem anymore. So we also plan, in addition to, now that we have an alumni of about 75 Indo-American Cancer Association fellows, we want to use them as ambassadors and use the opportunity to train the trainers. So they have been trained in the US, so we want to create solid programs here that would help us facilitate scientific temperament, data collection, streamline guidelines for treatment, because it's different in different places. And if you ask one doctor, if you go to 10 different doctors, you get 20 different opinions. So and there's a cost issue here as well. So and the problems that are similar, that are different in the United States, may not be applicable to here. So trying to have that and move the train the trainers program in India is what we plan to do, and we plan to do that about 3 or 4 times a year. So I think that will go a long way in facilitating and streamlining the programs here.